The broadcast is now starting. All attendees are in listen-only mode.
Well, hello everyone, and welcome to Question Lab. We're happy to have you here this Tuesday evening as we dissect 4 questions on the topic of MSK. Leading tonight's session one more time is Dr. Paras Vakarian. He's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a current dermatology resident, and I am also an RX coach with USMLE-Rx. I originally graduated from pharmacy school and then went on further to do medical school. Like I said, I'm an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
I know I mentioned RX Coach earlier. RX Coach is our tutoring and coaching program, and what we do with that is work with students one-on-one to help you on your academic journey and give you the advice, skills, and guidance you need to make your study more efficient and help you maximize your potential. We'll talk more about RX Coach later. What I want you to know for right now is that the methodology we employ in RX Coach is very similar to the methodology that we will employ this evening during Question Lab. So without any further ado, let's get into our first question of the evening. As you can see, the answer choices are covered up. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process. And we don't want you to see an answer choice that you're unfamiliar with that may cause you to panic as you're trying to answer the question on test day. So I've removed those answer choices for you. And we will begin with the lead-in, which is the last sentence or the question itself. And the reason we do that is because we want you to know what the test writer is asking prior to you reading that vignette, so you can pick up on all of those relevant clues and avoid having to waste time and reread questions on test day. So let's take a look at that lead-in together. The patient's most likely condition is caused by abdominal organs passing immediately adjacent to which of the following structures? This patient's most likely condition is caused by abdominal organs passing immediately adjacent to which of the following structures? I'll give all of you a few seconds to respond in the question box. If you look at your GoToWebinar control panel, you will see a question box. Take a look at that and feel free to let us know how many steps you think this question will require. An example of a one-step question could be where you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment for a diagnosis. An example of a three-step question is when you're asked for the mechanism of action for a treatment for a diagnosis. So we'll give all of you a few seconds here to respond in the question box and let us know how many steps you think this question will require. All right, I see some responses coming in. We'll give all of you a few more seconds here. All right. Let's take a look at that vignette. A 2-month-old boy is brought to the office because of a right-sided scrotal bulge recently noticed by his mother. She reports it comes and goes and is more noticeable when he is crying. Physical examination shows no other abnormalities. This patient's most likely condition is caused by abdominal organs passing immediately adjacent to which of the following structures? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and first show you what we think are the important clues in this vignette and the lead-in. So starting off, we have a pediatric case. Okay, we have a 2-month-old boy. So the first thing they're going to give you generally are demographics. In this case, we're told it's a 2-month-old. So automatically, we can start to clue in on things and work towards coming up with the right answer. And then they usually tell us, why is this patient coming to be seen? Why are they seen by the doctor? Why are they in the hospital? And in this case, it's because of a right-sided scrotal bulge. Okay, so you want to make note of what we call the presenting signs and symptoms. Okay. Now, in this case, we can see it's a little bit of a shorter clinical vignette, so there are going to be some important clues in the next 1 to 2 sentences. Okay, we're told it comes and goes. It's more noticeable when he's crying. Okay, so there are some clues there. Now, this question, as we could see, was a little bit of a longer question. It asked us not just what the most likely condition is, but it's caused when organs pass adjacent to what structure. So we need to answer a few steps here. 1, what is the most likely condition? And then 2, in this condition, what is it passing through? And maybe, you could wrap in that, an adjacent structure, or that could be kind of like a pseudo third step of what is a nearby structure that the organs pass through. So maybe a 2 to 3 step question. I'd lean towards a 3-step question here. Okay, so most likely condition, the abdominal organs pass through what, and what is an adjacent structure? So let's go ahead and let's take a look at those answer choices. And what we see here are 5 answer choices. So what we're going to do is we are actually going to walk through them, and we recommend when you go through these answer choices that you start at the bottom and work your way up to the top. So start with answer choice E and work your way up to answer choice A. And the reason we recommend that is because a lot of times we'll see students who start at the bottom, they'll see something they like and they'll select it without having gone through all the answer choices. So a lot of times they'll get that question wrong as a result. So we recommend doing it this way to prevent yourself from biasing yourselves and not make that mistake. So let's go ahead and let's do that now. Answer choice E, rectus abdominis muscle. D, psoas muscle. C, obturator foramen. B, linea alba. And A, internal oblique muscle. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. Yes, indeed, the poll is open. If you notice, the last word is structures. It got truncated there because of character limitation. So the last word there is structures for any of you who may not have caught it. So we'll give all of you a few moments here to submit your responses. Once again, we'll wait until about 2/3 of you have responded before we move on. Keep in mind that on test day, there is no penalty for guessing. You should never leave a question blank. And tonight, if you're not sure, don't worry. We're here to learn together. Take your best guess, and then we will go over the incorrect and incorrect answer choices together in just a moment. See the responses coming in. We'll give all of you a few moments here. We've got about half of you responded so far. All right, well, let's take a look here and see what you selected. So we had a clear favorite. 49% of you selected A, internal oblique muscle. In distant second place with 21% selecting was answer choice E, rectus abdominis muscle. So let's take a look and see what the correct answer is. And the correct answer is indeed A, and 49% of you got it right. So great job, everyone. Let me hand it off to Boris.
Thank you, Sean. So let's go ahead and let's take a look at this question one more time. So this is a 2-month-old, okay, who most likely has an indirect hernia. Okay, this is usually congenital. Usually we see it in male infants. Now this type of hernia, so that's step number 1, an indirect hernia, the abdominal contents travel through the inguinal canal. Okay, that's step number 2. And they travel through the inguinal canal, follow the pathway of the descended testes. And the hernia may enter the scrotum, as in this patient, and you can feel or see that bulge, usually when they are straining or crying, okay? So let's take a look at the next slide, and let's kind of take a look at what that looks like visually. And you can see those abdominal contents, how they can go through that inguinal canal into the scrotum, okay? That's the path that they follow, that blue long arrow there, okay? Now you can see that this would traverse a few things here, okay? So indirect hernias travel adjacent to the transverse abdominis muscle, the internal oblique, and the external oblique aponeurosis, okay? So those are the 3 muscles that it would pass adjacent to, okay? And only one of those was an answer choice for us. So it's important to kind of pick up on those 3 steps, but also know kind of how this is happening, okay? And what structures it is passing through. So if we go back to our question, you could see why answer choice A is the best answer. It's the only one of those 3, the transverse abdominis, the internal oblique, and the external oblique that is present in those answer choices. Now the other answer choices, the rectus abdominis, that is more midline. The psoas muscle is more in the lateral lumbar region near the pelvis. The obturator foramen, that's an opening in the front of the pelvis. Inguinal hernias do not pass adjacent to this. Lastly, answer choice B, linea alba. That is a little bit of a tendinous structure in the midline of the abdomen as well. So the best answer choice here, like you guys selected, is A.
Well, thank you very much, Boris, and great job, everyone. We are off to a strong start. Let's continue and keep that momentum going with our second question of the evening on the topic of MSK. Once again, the answer choices are covered up, and we will begin, as always, with the lead-in. This patient will most likely experience weakness in which of the following movements? This patient will most likely experience weakness in which of the following movements? Once again, I'll give all of you a few moments here to respond in the question box and let us know how many steps you think this question will require, and then we'll move on to that vignette. I'll give you a few moments here. All right, I see some responses coming in. Let's take a look at that vignette. A 35-year-old sanitation worker comes to the clinic with severe lower back pain that began suddenly as he was lifting a heavy load. He describes the pain as sharp and radiating down his left leg and foot. He does not report bowel or urinary incontinence. The pain is reproduced when the patient's left leg is lifted at a 30-degree angle. Ankle jerk reflex. Testing reveals a 1+ on the left side and 2+ on the right side. Sensation to pinprick is diminished markedly on the lateral portion of his left foot. The patient will most likely experience weakness in which of the following movements? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are those important clues in the vignette and the lead-in. Okay, so now we've got a little bit of an older patient, 35-year-old worker, and they tell us that he is a sanitation worker. Whenever you're given something about history or social history right off the bat, like they did here, it oftentimes is going to play a role in this question. You know, they say a 40-year-old alcoholic patient. A lot of times that alcohol history is going to play a role. And in this case, we can see it does. This patient's coming in with severe lower back pain. Okay, and here they tell us it began suddenly. So we know this is more of an acute issue rather than a chronic issue. This began months ago. Okay. Now, whenever you have pain, whenever you have neurologic pain like this, you often want to make note of how they describe the pain. Is it sharp? Is it dull? Where does it radiate? Where does it come? Where does it go? You often also want to ask questions about incontinence because that can tell you just how severe this injury is. Okay, and as we're dealing with kind of this MSK neurology exam, you want to make note of anything that can help clue you into the diagnosis. So neurologic testing. How is the pain reproduced? How are the reflexes? How is motor strength? How is sensation? Are there any neurologic deficits that can help you localize the deficit? Okay, and we kind of highlighted what we think would help you do that there. Now, this question is then asking us the patient would experience weakness in which movement. So I think we've got a couple steps here. I think one, we've got to figure out what's going on, and then maybe two, what additional areas or issues would this patient have weakness with? So I think a two-step question here. Let's first figure out what's going on, and then two, try to figure out maybe what else this patient could have weakness in, okay, when it comes to movements. So let's take a look at those answer choices. And once again, we're going to start at the bottom. We're going to work our way up to the top. Answer choice E, toe extension. D, plantar flexion of foot. C, knee extension. B, hip flexion. And A, dorsiflexion of foot. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. The poll is open. Once again, we're going to wait until about 2/3 of you have responded. As always, we do have a raffle at the end of the evening, so make sure you stick around because you must be present to win. And we do have a special offer also for those of you in attendance, or at least a special announcement in case you haven't heard it already. All right, I see the responses coming in. We'll give all of you a few more moments. All right. Just a few more seconds here. Looks like there's a clear favorite once again. And let's take a look and see what you selected. 49% of you selected A, dorsiflexion of foot. In distant second place, we had plantar flexion of the foot. So let's take a look and see what the correct answer is. And the correct answer is D, plantar flexion of the foot. That was our second most popular answer choice, with 26% of you selecting that. So definitely a tough question, but don't worry. Boris is going to explain it to you now. Boris.
Thank you, Sean. Yes, definitely a tough question. So figuring out that maybe it was something either dorsal or plantar flexion. So let's take a look. So this patient, hopefully you guys picked up on, this patient likely has a herniated disc in the back, okay? Usually can happen with heavy lifting, okay? We also know this patient has a herniated disc because of that positive leg lift test, okay? So this patient, when you lift their leg at a 30-degree angle, you can reproduce that pain, okay? And that test is very sensitive for a disc herniation at either L4, L5, or L5S1, okay? So this patient is likely experiencing lumbar radiculopathy at the S1 nerve root, okay? And we know that also because of the ankle jerk reflex being +1, okay? So if we take a look at the next slide, these are kind of our dermatomes, okay? So these are the dermatomes of our body, and it's important to know because a lot of times they'll tell you, you know, this patient has decreased sensation over the plantar foot, the lateral foot, the dorsal foot, and based off that, we would kind of need to know what area is affected. And they told us this patient has decreased sensation on the lateral portion of the foot. So you can see there, a lot of that is S1. Okay, in that very first graphic, that red band that's kind of going down, lateral foot, that's sensation, okay? Now if we move on even to the next step, or sorry, the next slide, one more slide, this is looking at signs of lumbosacral radiculopathy. And you can see there, this patient who has an S1 nerve root being compressed would also have a decreased Achilles reflex, just like our patient did, okay? As a result, they can also have weakness of plantar flexion, okay? Weakness of dorsiflexion, that would be more L5. And weakness of knee extension would be L4, okay? So that's a really nice table in first aid. Make sure you guys know that. They love to ask questions about this. So looking at the other answer choices, toe extension. Toe extension would be more with an L5 radiculopathy. Knee extension, like we said, would be more an L4 radiculopathy. Hip flexion, a little bit higher up than what we're dealing with in this case. And then lastly, dorsiflexion of the foot, like we talked about, that would be more of an L5 radiculopathy. So there were a couple clues here helping to point us to S1. That was the ankle reflex being low, as well as the sensation being diminished on the lateral portion of the left foot. So two important physical exam findings there that help localize this to S1, okay? So great job on this question as well.
Well, thank you very much, Boris. As always, we appreciate your explanations. You know, I mentioned RX Coach to you earlier. I want to take a moment here to tell you a little bit more about it. So RX Coach is our new coaching and tutoring program. It's not new anymore, actually. I'm just used to saying that. What we do is we work with you one-on-one to help you accomplish your goals. So if you're studying for a comprehensive shelf exam or a board exam or a practice exam, USMLE Step 1 or Step 2 will start you off with an assessment. Then based on that assessment, we'll help you come up with a personalized study plan, right? And then we'll help you implement that study plan, and we'll hold you accountable. But once you study a subject, once you finish a topic or an organ system based on that plan, you'll meet with your tutor to review that topic, ask any questions you have concepts explained to you, and do practice questions together. Now, today, you know, we're not able to ask you what you want to highlight or what you're thinking after every sentence or what's on your list of differentials or why is the wrong answer wrong or why is the right answer right. But we'll do a lot of that, and that'll help us identify your knowledge gaps and bridge them, but also ensure that you have good test-taking skills and can apply what you've learned. And by doing that, we're really able to help students make their studying more efficient, come up with a game plan that works, work on their test-taking skills, identify the knowledge gaps, and really take the guesswork out of studying. If you're studying for an in-school exam or a subject-based shelf exam, we'll work with you with your learning objectives, and your syllabus and your resources and the ones we provide to you, and make a plan accordingly. So if you're interested in working with the coach to maximize your potential, to really make sure you're doing everything you can do to have the best score possible, even though step 1 is pass-fail now, you still want to have a good foundation because it'll help you in your clinicals. It'll help you also on step 2. So take a look, visit us at rx-coach.com. You can find more information there about our different packages. And if you're interested in the program and talking more about it, schedule that free consultation and we can talk about the program and how it can benefit you. Once again, that website is rx-coach or rx-coach.com. Now, that being said, we do have a raffle at the end, so make sure you stick around. And for those of you asking what next week's topic is, next week we're going to tackle step 2. So make sure you come and join us if you're interested in working on some step 2 questions together. So let's move on to our third question of the evening. As you can see, the answer choices are covered up, and I will begin once again with the lead-in. Which of the following structures is innervated by the most likely injured nerve? Which of the following structures is innervated by the most likely injured nerve? Once again, we'll give all of you a few moments here to respond in the question box and let us know how many steps this question will require. All right, I see some responses coming in. Let's take a look at that vignette. A 32-year-old man comes to the emergency department because of increasing numbness and tingling on the right side of his hand. 2 days ago, he sustained a crush injury to the right forearm at work. The initial injury was x-rayed and no fractures were found, and the pain in the forearm is now well controlled with ibuprofen. Neurologic examination reveals weakness of flexion in the 4th and 5th fingers and decreased grip strength. Which of the following structures is innervated by the most likely injured nerve? Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay. So now we've got a 32-year-old male, and he has increasing numbness and tingling, and they tell us it's on the right hand on the side of it, the side of his right hand. He's got increasing numbness and tingling. We are also told about some important history. 2 days ago, he had an injury to the arm, specifically the forearm. Okay, they didn't see a fracture, but they're telling us the pain is controlled with ibuprofen. But again, as we know, that neurologic exam is going to be very important here. Weakness of flexion in the 4th and 5th fingers and decreased grip strength. Okay. So using those clues, we've got to figure out which structure is innervated by the most likely injured nerve. So I think we've got 2 steps here. 1, what is the most likely injured nerve? And then 2, what other structure does it innervate? So I think we've got a nice 2-step question here. So let's go ahead and let's take a look at those answer choices. Once again, we're going to start at the bottom and we're going to work our way up to the top. E, skin of the palmar middle finger. D, skin of the lateral forearm. C, lateral portion of the flexor digitorum profundus. B, extensor digiti minimi. And A, adductor pollicis. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you, Paris. Once again, the poll is open. If there are subjects that you'd like us to tackle in Question Lab, please feel free to let us know in the question box. All right, I see some responses coming in. We'll give all of you a few more moments here. I know oftentimes we don't review these subjects again once we're in 2nd or 3rd year, so it might be some stuff you haven't seen in a while, but it's a good review, and I'm happy you're here. Got about 40% of you so far have responded. Looks pretty close. Not really a clear favorite yet. Getting close. Let's take a look and see what you selected. So the favorite here, 35% was adductor pollicis, and then 24% of you selected lateral portion of the flexor digitorum profundus. So let's take a look and see what the correct answer is. And the correct answer is A, adductor pollicis, and 35% of you got it right. So it was a challenging question. Let's pay attention to Paris. Here we go, Paris.
Thank you, Sean. Yes, great job, guys, but definitely a tough question. So the important clues here, like we said, weakness of flexion in that fourth and fifth finger. So hopefully you guys are picking up that this is an injury to the ulnar nerve, okay? Because what ends up happening is flexion of those distal joints is done by the flexor digitorum profundus, okay? Specifically, the medial part of that, and that attaches to the fourth and fifth digits, okay? So let's take a look at the next slide, and we'll see here some important tables from our MSK section. We can see here that the ulnar nerve, okay, how it can present with an ulnar claw on extension of the digits, okay? So you can have decreased flexion of those ulnar fingers like our patient did, so decreased ability to flex that fourth and fifth finger, okay? And on top of that, decreased grip strength as well. And you can see patients, when they make a fist, they are unable, in that OK gesture at the bottom left, when they try to make a fist, they are unable to flex that fourth and fifth finger because of damage to the ulnar nerve. And like we said, that muscle is the flexor, so flexing, digitorum, digits, profundus, large. It's a large muscle if you ever look at it in anatomy lab. So having difficulty with flexing of the digits, but it's the medial side of it, because remember, our ulnar side is on the medial side of the anatomic body. The radial side is lateral, okay? So if we take a look at our answer choices, we can see here that ulnar nerve is most likely what the issue is, and this also innervates the adductor pollicis as well as the interossei, okay? Now the other answer choices are incorrect for a few reasons. So answer choice E, this is innervated by the median nerve, not what the issue is. Skin of the lateral forearm, that's innervated by the lateral cutaneous nerve of the forearm. That is a branch of the musculocutaneous nerve. Answer choice C, this is a very close answer, but that, remember, that is the lateral portion of the FDP. We are talking about the medial portion of the FDP. The lateral portion is supplied by the median nerve, okay? Lastly, answer choice B, this is also done by a branch of the radial nerve. So a nice two-step question here, figuring out this is an ulnar nerve injury, and then having to know what other structures it innervates. So definitely a tough question here.
Well, thank you very much, Paris. Let's move on now to our fourth and last question of the evening before we move on to our raffle and special offer. Once again, the answer choices are covered up. That is by design, and we will, like always, begin with that lead-in. The affected nerve is a branch of a larger nerve that controls which of the following muscles? The affected nerve is a branch of a larger nerve that controls which of the following muscles? Once again, we'll give you a few moments here to respond in the question box and let us know how many steps you think this question will require. All right, I see some responses coming in. If this is your first time attending Question Lab, please let us know in the question box. We'd love to hear from you. All right, I see some responses coming in. Let's take a look at that vignette. A 45-year-old man comes to the clinic because of shortness of breath and hoarseness for the past week. He was hospitalized in India during childhood hospitalization for a major febrile illness. He is found to have mitral stenosis with an enlarged left atrium impinging on a nerve. The affected nerve is a branch of a larger nerve that controls which of the following muscles? Paris.
Thank you, Sean. So let's go ahead and show you what we think are the important clues in this vignette and the lead-in. So this is our fourth time doing that. So hopefully you guys are starting to get a sense of what are those important questions and clues in the vignette and lead-in that you want to be picking up on. Okay, so in this case, we've got a 45-year-old man, and he's coming in because of shortness in breath and hoarseness, okay? Now, definitely not your typical MSK type question, right? So we're told a little bit about social history, that he was hospitalized in India because of a fever or febrile illness, found to have mitral stenosis with an impinged left atrium, or enlarged left atrium impinging on a nerve, okay? So that's hopefully where you can start to see the MSK component. Now we're told, and we're being asked, that that affected nerve is a branch of a larger nerve, and it controls what muscle? So I think we've got a few steps here. One, we've got to figure out what is the affected nerve. Two, what is the larger nerve that it is a branch of? And then three, what muscles does it control? So I think a nice three-step question here. So we are going to go ahead and show you what we think, we're going to go ahead and show you those answer choices. Once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, stylopharyngeus. D, styloglossus. C, palatoglossus. B, mylohyoid. And A, hyoglossus. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. Looks like we're a little ahead of schedule. That's generally not the case, but today, simply because the answer choice is a little more direct and easier explanations, largely thanks to Boris. So our last question of the evening, let's try to finish strong, and then we'll move on to our raffle. Once again, next week, we'll be covering step 2, so make sure you join us. And the following week, we'll be covering cardiac physiology. Like I said, if you have suggestions on which subjects we should cover in the question lab, please let us know in the question box. All right. A few more seconds here. All right, let's take a look and see what you selected. Well, 45% of you selected E, stylopharyngeus, and then it was tied for second place with styloglossus and palatoglossus. Let's take a look and see what the correct answer is. The correct answer is C, palatoglossus, and 18% of you got it right. So definitely a challenging question. Let me hand it off to Boris.
Thanks, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, and how that led to this correct answer choice here. Okay. So like we said, the best answer choice here is C. So let's take a look at this question. So if we take a look at this vignette, we see that this patient has an enlarged left atrium, okay? And that can compress the left recurrent laryngeal nerve. And that can present as hoarseness because that recurrent laryngeal nerve innervates all intrinsic muscles of the larynx, except for the cricothyroid. Okay. Now this patient probably has that enlarged left atrium from mitral stenosis, from rheumatic heart disease. So that's what they were getting at in that vignette. Okay. Now the recurrent laryngeal nerve is a branch from the vagus nerve. Okay. If we take a look at the next slide, we can take a look at that tongue development, and we can see there what muscles are innervated by which nerve. Okay. So we can see there at the very bottom, motor innervation via cranial nerve 10, or the vagus nerve, is to the palatoglossus, which was the correct answer in our question. Okay, a lot of the other motor innervation to the tongue muscles are from cranial nerve 12, as you can see there. Okay, so if we now take a look at our question and our answer choices, you can see there why answer choice C is the best answer. The other answer choices, answer choice E and answer choice D. The stylopharyngeus is innervated by the glossopharyngeal nerve. The styloglossus is also innervated by the hypoglossal nerve. The mylohyoid is innervated by the trigeminal nerve, and the hyoglossus is innervated by the hypoglossal nerve as well. So different nerves innervating those muscles. So great job on today's questions. I will hand it back to you, Sean.
Well, thank you very much, Boris. Great job as always. And great job to all of you, and thank you for attending. If you want to review these questions in more detail, make sure you've mastered these topics. Simply make note of these question IDs. You can take a picture, you can take a screenshot, and simply type these into the RX search field and pull them up to review further. So I'll give all of you a few moments here to make note of these QIDs.